Good morning, everyone. This is Doug Roehm from the Strategic Services Group. We're excited to have you here this morning. We're excited to have Larry Grudzien, our ERISA attorney, present this morning about common questions we're finding in healthcare reform. We hope that this is an informative seminar for you, and we look forward to our future seminars. Larry, handing it over to you.
All right, thank you very much. The purpose behind this seminar is to kind of clue you on some of the common questions I've been getting from my clients, and maybe you're asking yourself in regard to healthcare reform. Now, as I go through this, you'll see on the slides the questions, and I'll be explaining the answers. This webinar will be recorded, so if you and I'll be sending a copy of that, and it'll be available. Now, if you want to ask a question during the seminar, I'll be stopping every so often to take questions. If you look at the dashboard to your right, down the dashboard, there's a question tab there. Click on that, write your question in, and then I'll make sure during the seminar, at the end of the seminar, we address as many questions as possible. That's the purpose behind the seminar. There's a lot of confusion, a lot of misinformation going around, and so I want to make sure that your questions are answered and some of the cloudiness is taken care of. All right, let's look at the first question. And the first question is, which employers are subject to the employer mandate in 2014? Please remember, and there's some confusion on this, that only a large employer will be subject to the employer mandate in 2014. And a large employer is defined as any employer that has 50 or more full-time, it's 50 or more full-time employees, and that's for the previous calendar year. Now, in determining whether you're a large employer, what we do, we consider all employees, both full-time and part-time. So it's extremely, now if you are less than 50, then there's no employer mandate that you have no responsibility to sponsor any health plans. But for small employers, I'll have some questions in regard to that in the next few minutes. Remember that your employees, if you don't provide coverage to those employees, they can go on the exchange and get credits and subsidies, but you won't be penalized. So it's important to determine during 2013 whether you are a large employer or not. Now, if my employer is a large employer and sponsors a health plan with a non-calendar year plan year, when does it have to comply with the employer mandate? Now, generally, the employer mandate is effective January 1st, 2014. In December, the IRS created a special exception. So if your ERISA plan has a plan year other than January 1st, you can use that renewal later in 2014 to start complying with the employer mandate. Now, the problem is that the IRS put some conditions on it, and what the conditions are is, one, as of December 27, 2012, did the employer either cover at least 1/4 of your employees, or did you offer the coverage to at least 1/3 of your employees? And when they say employees, it's both full-time and part-time. That's in the calculation. So you had to satisfy one of the two requirements and then offer minimum coverage starting in 2014. So let me repeat that over again. In order for an employer to use that non-calendar year plan year as a date that you have to comply, you either had to offer coverage to at least 1/3 of your employees or covered at least 1/4 of your employees as of December 27, 2012. So it's not necessarily a slam dunk. Let's look at question 3. How does your employer determine if it's a large employer for employer mandate purposes? Well, basically, we do that calculation during 2013. We take an average for the calendar year. We total up the number of employees for each month, and then we basically take the total and we divide by 12. Now, which employees are considered in this calculation? All employees are considered in this calculation, both full-time and part-time. So you total, and remember, a full-time employee is anyone who works 30 hours or more, so each full-time employee is considered to be one employee. Now, for part-timers, what you do for each month is you have to take the total number of hours for that month that the part-timers are working and divide that total by 120. That will give you something called a full-time equivalent employee. So for this purpose, all employees' hours are considered. And what confuses people in that situation is the fact that once you determine whether you're a large or small employer, there's no obligation if you're a large employer to offer any coverage to part-time employees. So the only thing they do is that they could make a small employer a large employer if you employ enough part-time people. Over what time period is this determination made? It's during calendar year 2013. But just recently in December, the IRS created a special exception that said for 2013, you can use any 6-month period during 2013 to do this calculation. So even though the statute says it is done during the calendar year, the IRS created a special exception only for 2013, and what they indicated is, Mr. Employer, you take any consecutive 6-month period and make that determination. I just talked to a long care employer, a nursery, that they're going to be using the first 6 months of 2013 to do the calculation, because during the months of January, February, and March, their employee count is down. So because of that, their average is going to be below 50. So they have a breathing room for 2014. So again, this calculation is generally done during the calendar year, but for 2013, you can use any consecutive 6-month period in 2013 to do the calculation. Now, there's one other special exception in counting employees, and this is if you employ seasonal employees for less than 4 months. Suppose you run a number of ice cream stands, and during the year you generally employ 30 employees, but during the summer, 4 months, you employ hundreds of people. And because of employing hundreds of people, the average will make you over 50. The IRS, the statute says that if you employ seasonal employees for 4 months or less during the year, those seasonal employees are not considered to determine whether you're a large employer. So again, there's a couple of special exceptions you should be made aware of. In determining whether an employer is a large employer for an employer mandate purposes, when do we have to consider other businesses owned by the employer in that total? And this is the very common question I've been getting, because in order to determine whether you're a large employer or not, it's done on a control group basis. This is the same calculation that's done for tax purposes, for retirement purposes. Your accountant or attorney could tell you whether you're a member of a control group. But generally, these rules are extremely complicated, but generally the same 5 or fewer individuals must own at least 80% of each entity in order to be a control group. So for a large employer calculation, all businesses that your employer owns as a controlling interest will be considered to be one employer to determine whether you're a large employer. So it's done on a control group basis. So now we determine whether you're a large employer or not. And now, what's your obligation? And question 5 is, does the employer have to offer health coverage to the employee's children or spouse? And clearly, if you are a large employer and have to offer coverage, you have to offer coverage, of course, to the employee. And what they indicated, you do have to offer coverage to the dependent children, but not the spouse. Now, your obligation as a large employer is you have to offer coverage to the employee's children, but you, Mr. Employer, don't have to pay for it. So if we do, does the employer have to pay for it? And the answer is no. You just have to offer it. The affordability calculation only applies to single coverage to the employee. There's no obligation starting in 2014 to pay for any part of the dependent coverage for the children. Now, remember, starting in 2014, you have no obligation to provide coverage to the employee's spouse. So this is a clarification that came out in December of 2012. The IRS indicated that. Let's go on to question 6. In determining whether health coverage is affordable, any premium charged to an employee cannot exceed 9.5% of the employee's household income. How is an employer going to determine that figure? Well, the IRS in December of 2012 came out with some safe harbors. And they said, Mr. Employer, you can base that 9.5% figure on box 1 of W-2. That's the previous year. The rate of pay that you're paying someone times 130 hours per week. Or third, the federal poverty line safe harbor, which currently is 11.6. You take 9.5% off of that. So what the IRS said, in any year you can use any of those 3 safe harbors, but you can only use one of the safe harbors. So for W-2, it's the employee's previous year W-2, and it's box 1, which is the taxable figure. So that figure is a net figure and does not include contributions to 401k contributions, cafeteria plans. So it's a lower figure, but that's what you base it on. And please remember, that's only based on single coverage, not on family coverage. So it's just on single coverage. Now, there's 3 ways of dealing with this, and employers can decide what to do. In this situation, what the employer can say is, okay, each employee will not pay more than 9.5% of their W-2 wages. What that means is, as the employee's income goes up, their obligation to pay for the coverage goes up. So you could have some employees that pick up the entire cost and coverage. You can do it that way, and that's not discriminatory. The second way of doing it is say, okay, we're going to look at each employee's wages, and we're going to determine who is paid the least, base 9.5% of that, and no employee will pay more than that. That's another way of dealing with this. The other way that some employers are saying, we're not going to fiddle with this calculation. We'll pay for the single coverage. Now remember, it's based on a 60% plan. Most employer coverages out there are way above 60. They're 70 to 80%. So in doing this calculation for 2014, you may look into getting a cheaper plan, a 60% plan, and basing your contributions off of that. So there's no issue or problem with an employer offering 1, 2, or 3 plans and basing their contribution, the commitment of the employer, off the cheapest plan and saying, Mr. Employee, if you want to cover your dependent children, if you want to cover your spouse, or if you want to pay for a more expensive plan, it's your dime. But we're only going to base our contributions on that 60% plan. If you want a 70 or 80% plan, hey, it's your dime, you have to pay for it. Now let's stop for a second and see if anybody has asked any questions yet. I don't see any questions yet. Please don't hesitate if you have any questions. This is a good time if you have any questions on anything I've talked about so far. Please don't hesitate to go into the question tabs. And I don't see any questions yet. Well, again, I'll stop periodically and see if there's any questions anybody's asked. Let's continue. Now, again, I've already covered this, but I want to emphasize this in question 7. What type of health coverage is the affordability test based on? It's only based on single coverage. So starting in 2014, there's going to be a major shift in how you as an employer pay for coverage. Because starting in 2014, the federal government says your only obligation, if you're a large employer, is to pick up the tab for single coverage. Some questions have been coming in. So in the future, you don't have any obligation to pay for any family coverage, just the employee. Let's look and see what questions we have. Can you state the formulas used to decide if coverage is affordable? Box 1, W2, thanks. Well, again, the affordability test is based on 3 safe harbors. One is box 1 of W2, and that's the previous year's W2. So whatever is in box 1, you take 9.5% of that. Now, for 2014, you would have to, again, determine what box 1 is for 2013 and use that figure. Another safe harbor is taking the rate of pay that you pay someone, 10, 12, 15 bucks an hour, and multiply that by 130 hours. You can base it off of that. The third safe harbor is the federal poverty line, and that is basically this year 11.6, and you base 9.5% off of that. All right, let's go to the next question, question 8. Our employer sponsors a wellness program. If the employee satisfies certain wellness standards, his or her premium is reduced. For the affordability test, which premium is used? The IRS came out with regulations on this, and what they said, the only wellness standard that is used is for smoking cessation. And so for that situation, if you do give a benefit if somebody quits smoking, that is used to reduce the premium, and that's the only one that is being used. Now, what they've indicated, if you do sponsor a smoking cessation program, it's treated as if everyone qualifies for the discount, so the lower premium is used. Any other wellness benefit, either credit or subsidy, excuse me, is not considered, so we use the higher amount for that figure. If the employer is determined to be a large employer, does it have to offer health coverage to part-time employees? And the answer is no. And the reason why there's some confusion in that, a couple of factors are extremely important to consider. There are some employees that some employers employ that are called variable hour employees. They don't work because of the time of the year or because of projects. They may not work full-time. And please remember, if you employ anyone that is full-time, the maximum waiting period they have to wait to be covered is 90 days. They have to receive coverage in after 90 days. If you have any part-time or seasonal employees, what you have to do is go through a calculation to determine whether they are full-time or not. And you can use a measurement period from 3 to 12 months to make that determination. Now, if somebody picks a 12-month measurement period, in order for that part-time employee to be offered coverage, they would have to work 1,560 hours, which is 130 hours per month times 12, or 1,560. So whatever measurement period you pick, it's 130 hours times the number of months that you pick. So if you pick a 10-month measurement period, it's 1,300 hours. So in order for that part-timer or seasonal to be considered full-time and to be offered coverage, that person must be deemed to be working full-time during that measurement period that you pick. So again, for those of you who have to offer coverage in 2014, whatever date that you have to offer it, you have to look back, determine the measurement period, and determine whether any of your part-timers are seasonal or full-time. And during that calculation, if they are full-time, then you have to offer them coverage for the next period of time, either 6 or 12 months. Well, a question come in, do you anticipate employers manipulating against the law by providing a bronze 60% plan that meets the 9.5 just so they are penalty proof? The answer is yes. Most employer coverages out there are way beyond the 60% figure. So what you may want to consider in 2014 is getting a 60% plan based on your contribution off the 60% plan, and then what you may want to offer is then a richer plan, a 70 or 80% plan that you probably are normally providing in the past. You can continue to provide it in the future. But I mean, that's something you may want to consider. Other questions? Is smoking cessation penalty subject to the 9.5% test, or can we charge more than a 9.5% smokers? If you, as an employer, as I indicated before, sponsor a smoking cessation program, that's the only wellness incentive that it's considered. And what the IRS said is that we treat it as if everyone that's covered by the plan satisfies that smoking cessation, and so therefore the cheaper premium would be considered for the 9.5%. What is the most commonly used safe harbor among your clients to date? I think probably the W-2, but the W-2 safe harbor, it cannot be used if you have a lot of turnover because you don't know what the W-2 figure is, and especially if you have somebody that only works for you for a few months. So again, you can only use one safe harbor. You can't use more than one safe harbor during a time period. Bear with me a second. Could you repeat the part about the 1,560 hours during 2013 measurement period, that an employer doesn't have to work 1,516 minimum? They are not considered to be full-time. Therefore, we do not have to offer them coverage. For anyone who works part-time or seasonal, whose hours will vary, what you have to do is go through a calculation and pick a measurement period. And that measurement period is any period from 3 to 12 months. And during that measurement period, it's 130 hours per month. So if you pick a 12-month measurement period, which most employers are picking, that's 130 hours times 12, or 1,560. So if you pick a 12-month measurement period, in order for that part-timer to be considered to be full-time and offered coverage, that part-time person must work 1,560 hours, but only if you pick a 12-month measurement period. Now, if you pick a 12-month measurement period, then I have to offer them coverage for, again, 12 months, which is called the stability period. That's the period that you offer them coverage. Let's go on. Now, in any year, do we have to offer coverage to part-timers even if their hours go below 30? And this is an important question, and it highlights an issue and a problem some of the employers are going to have. Because the fact, if you do the calculation and you determine that some of your part-timers are seasonal or full-time, during the coverage period that the government calls the stability period, you have to offer them, continue to offer them coverage even if their hours dip below 30. Now, we don't know at this point. There's been no guidance in this. And during the stability period, does an employee have to work 1 hour a week, 1 hour a month in order to continue to be covered? But what they've indicated is you have to continue to offer them coverage even if their hours, average hours, dip below 30. So you do the calculation during the measurement period. Some of your part-timers work 1,560 hours. You offer them coverage. They take it, and then the next 12 months, their hours are going below 30. Some weeks they work 20, some weeks they work 10, some weeks they work 40, depending on the schedule. The challenge for you are going to be is calculating what is affordability, and secondly, if their salary runs short, how are you going to collect that premium for that coverage? Because what the government says is you can shut off coverage if that person doesn't pay their premium. So you have to collect, if their salary is too low, you have to collect that premium from the employee during the what we call the stability period. So this is going to be a very interesting situation for some of you if some of your part-timers dip below 30 during the stability period. Now the questions come up, well, what if I do this starting in 2013? I say to my part-timers, sorry, but you can never work more than 28 hours. Do I have to do any of this calculation? And the answer is no. The only time you have to do this calculation, if you're part-time or seasonal employees, their hours will vary during the measurement period. And so basically, we look at them whether on average do they work 30 hours a week. That's the purpose of the calculations. So if you know that your part-timers never work more than 28 hours, then you never have to offer them coverage. But whether that's realistic and whether any part-timer will ever go above 28 hours is going to be interesting to see how employers are going to monitor this. Okay. Now let's take some more. Let's go to question 11. If we hire an individual as part-time, and then his or her status changes to full-time, when do we have to offer him or her coverage? Well, the IRS has said you have to offer them coverage the earlier of the end of the measurement period or 4 months after their status changes. So, and this could happen every so often where you hire somebody and they work out very well, and you say, we want this person to work more hours, so you change their status to full-time. So the question is when you have to offer them coverage. And again, there's guidance in the regulations that say you offer them coverage the earlier of the end of the measurement period or 4 months after the status changes. Now, question 12 illustrates another situation that could happen to you. If we hire an individual as full-time, later he or she begins to be working part-time. When do we have to drop coverage and redetermine his or her eligibility for health coverage? Well, again, if you hire someone full-time, remember you have to offer them coverage after a 90-day waiting period, so they have to be eligible on the 91st day. Now, a few months later, that person's status changes. For one reason or another, they go back to school, they decide not to work that many hours. So if their hours dip below 30, then you can drop coverage. And basically what you do, you re-measure their hours during a measurement period. And then at the end of the measurement period that you pick, you determine whether that person is full-time during the measurement period. So that's extremely important. Now remember, when that person's when that person's coverage is dropped because of working less than 30 hours, at that point you have to offer them COBRA. But again, at that point, what's going to be important is as soon as they're dropped from coverage and they're no longer eligible for your coverage, then they can go on the exchange and they may be eligible for a creditor subsidy. So this is going to be a very, very, very complicated situation. If we offer affordable minimal essential coverage to employees and their dependent children, and the employee goes on the exchange with his or her family, will the employee be eligible for any credits and subsidies on the exchange? And the answer is no. The government has decided to limit the ability of that individual to get credits and subsidies. So as long as you offer them affordable coverage, and you offer affordable coverage to the employee and offer coverage to the dependent children, that employee would be barred. They can go on the exchange, of course, but what that means is they can't get any credits and subsidies on the exchange. They have to pay full freight. And individuals have said, well, isn't that unfair to the spouse, because you as an employer don't have to offer any coverage to the spouse? Yes, it's unfair, but the government has determined they're trying to limit the eligibility for the credits and subsidies. Now, this is a very, very common question I've been getting. If my employer offers health coverage to 95% of its employees and their dependents, will it still be liable for any penalties? Now, what the government has done is given you, for the application of the $2,000 penalty, they've given you a fudge factor of 5%. Now, when could this happen that you don't offer coverage to 100% of the employees? Suppose you miscalculate and you determine certain part-time employees to be part-time instead of full-time. What happens? Could the employer be penalized? And the answer is, well, if any of those people that you don't offer coverage are full-time, you don't offer them coverage, and then they go on the exchange and gets a credit and receives a credit and subsidy, you could be liable for the $3,000 penalty. So just remember that 95% figure gets you out of the $2,000 penalty, but may not get you out of the $3,000 penalty for anyone who you don't offer coverage to. So please remember that. Let's look and see, just stop for a second and see if we get any more questions. Here's a few more. If we are currently not a large employer, but may reach the 50 employee threshold in the future, how long must we average 50 plus to be considered a large employer? The calculation, you have to average it over a calendar year. So every year you would do a calculation to determine whether you are a large employer. So again, what you do, you average your employee count during the calendar year, and basically you take your employee count for each month, both your full-time and what we call full-time equivalent employees, add up the totals for each month, divide by 12, and if that resulting figure is 50 or more, then you would have to offer coverage during the next year. So it's always on the previous calendar year. So for a public school operating 9 months, can we use 1,560 hours threshold for calendar year to determine full-time status for hourly employees for non-professional staff? Yes, you can do so, but with the IRS, there's a special calculation for educational employers. And what they said for absences of 4 weeks or more, you have a choice of either counting hours during that period, or, and this is important, or not considering that time period and extending the hours they work during the school year for the entire year. So for any absences of 4 weeks or more, you have that choice. So there's a special calculation for educational employers. And if you want more information on that, send me an email and I'll continue the rules. All right. Let's go to some more questions. Question 15. If my employer has various companies that do not offer coverage, will my entire employer be penalized? And this is an extremely important question. And let me give you an example how this works. Suppose you're an employer and you have three different companies in your control group, A, B, and C. And to make the example easy, let's say that each company has 30 employees. So 30, 30, 30, the company has 90 full-time employees at the large employer. Now for 2014, two of the A and B decide to offer coverage that's affordable. Company C decides not to, and that they have 30 employees. How is that employer then penalized if only one of the three decides not to offer coverage? And what the IRS has said is that only that company not offering coverage, that member of a control group not offering coverage, would be penalized. But remember, in regard to the $2,000 penalty, it's $2,000 for each employee minus the first 30. Well, what they indicated for this purpose, the 30 employee reduction is reduced. It's prorated down depending on how many employees that member of a control group has. Since that one member of control group only has 1/3 of the employees, they only get 1/3 of that 30 reduction, which means it's 10. So if that company with 30 employees doesn't offer coverage, we take 30 minus 10, or 20, times $2,000, so they'd be penalized $40,000 for not offering coverage. But the two other companies, B and C, would not be penalized. If an employer is not a large employer, does it have to offer any coverage to the employees? And the answer is no. You have no employer mandate starting in 2014. Now, one thing it's extremely important to understand, if you want to continue to offer coverage, as long as you offer affordable coverage to your employees, then if they go on the exchange, they can't get any credits and subsidies. So what you're competing against, starting in 2014, are the exchanges. And if any of your employees could be eligible for credit and subsidy, they'd rather go on the exchange and not pay that much money for their coverage as opposed to getting coverage from you. Now, just to give you the impact of these credits and subsidies, I did a study for one of my clients, an employee that made between $22,000 to $24,000 a year, family of 4, went on the exchange to purchase a $12,000 family coverage, and let's say their employer didn't offer them coverage, they would pay 2% of their salary as a premium per year, so they would pay for that $12,000 coverage $461. That's it. So you could have a situation starting in 2014 that some people don't want to work full-time and be eligible for coverage because they could make them ineligible for credits and subsidies. In my example, that employees may be saying, don't give me more hours. I want to be part-time, because if you make me eligible and offer me affordable coverage, then I lose that coverage, that subsidy, and in essence, I'm losing over $11,000 in subsidies starting in 2014. So therefore, it's going to cost me by working full time. So you could have some employees that figure this out when they go on the exchange, that this is a great deal and I don't want to give it up. Let's go to question 17. If a small employer offers affordable minimum coverage to its employees and dependents, can they go on the exchange and receive credits and subsidies? And I just covered this illustrate, and the answer is no. Now, as a small employer, you may want to make a decision, do I want to continue to offer coverage? Because of the fact that if I don't offer affordable coverage to my employees, I have to compete against the exchanges. and therefore it's going to blow apart my group health plan. So in 2013, as a small employer, you have no obligation. You're not going to be penalized. But what do you want to continue to offer coverage to your employees? And one thing I'm really, really fearful of is that when HHS unveils these exchanges, I'm concerned about whether they're going to work right the first 1 or 2 years. And if you decide to drop coverage and the employees goes on the exchange and they have trouble getting coverage for one reason or another, there's glitches. There's going to be glitches in the system. And they're going to come back at you and say, I couldn't get coverage on the exchange. Something happened. Are you going to feel responsible in that situation? That's an extremely important factor. So again, decisions have to be made in 2013 for 2014. Let's go on to question 18. In 2014, what coverage must a small employer offer if its health plan is non-grandfathered? And basically what you have to offer is essential health benefits. There's 10 different categories that you have to offer. And there's 2 factors that are real important. There's going to be limits on deductibles and copays. That's the second question. Will there be any limits in deductibles and copays? And the answer is yes. The maximum deductible if your plan is non-grandfathered is $2,000 for single coverage, $4,000 for family coverage. And the out-of-pocket limits are going to be $6,350 for single coverage, $12,007 for family coverage. Now, the out-of-pocket limits apply and include deductibles, copays, coinsurance. Those are the same limits, the out-of-pocket limits, that apply to high deductible plans. Now, the deductible limits I just mentioned do not apply to large employers. Now, remember in 2014, if your plan is non-grandfathered, the insurance companies can no longer rate you, and it's going to be community rated. The only factors they're going to use in 2014 is it family or single coverage, the ages of your employees, and whether they smoke. It's not going to be based on your previous experience. So all small group plans starting in 2014 are going to be community rated. Now, it's going to be supposedly a great deal for older workers, and it's going to be not a great deal for younger workers, because the age differential between the youngest and oldest employee is only 3 to 1. Just to give you some idea what the impact is going to be under current, and it varies from state to state, the variance in some states are anywhere from 6 to 8 to 9 to 1. So it's contemplated that the younger workers are going to pay much more, and the older workers may not pay as much as they have in the past. But again, if your plan is, if you're a small employer and you're non-grandfathered, your plan will be community rated starting in 2014. In 2014, what coverage must a large employer offer its health plan if it's non-grandfathered? Again, you have to offer minimum essential coverage if you don't want to be penalized. Now, are there any limits on deductibles and out-of-pocket amounts? And no, there's no limits on deductibles, but the out-of-pocket limit I just mentioned will apply to large employers, which means it's going to be $6,350 for single coverage and $12,007 for family coverage. Now, there's some controversy involved as what coverages will get you out of the $2,000 penalty, and there's been articles in all kinds of business magazines about the skinny plans. Be very careful about the skinny plans, because I think there's a hole in the guidance. They haven't really, for large employers, they haven't really explained what coverages will get you out of the $2,000 penalty. And some people are touting skinny plans as a way of avoiding the $2,000 penalty. And right now, I don't think it's very clear about what coverages an employer will offer to get you out of the $2,000 penalty. So be careful and wait, because I think guidance will come out, because I think everybody understands there's a gap in the guidance there. Now, question 20 illustrates a real issue and problem. Previously, Many small employers and medium-sized employers are using HRAs. They were buying very high deductible plans and using an HRA to supplement those plans. That's called an integrated HRA. What the government said, starting in 2014, if you're a small employer and you're subject to $2,000, $4,000 deductible limit, you cannot use an HRA to get down to those $2,000, $4,000 limit. You cannot use an HRA to get down to those deductibles. Now, large employers can still use it, no problem. But again, small employers are going to be prohibited from using HRAs for that factor. The other question is, can freestanding HRAs be used? Now, what the DOL said earlier this year is that freestanding HRAs, in other words, HRAs that you either reimburse premiums or expenses, cannot be used to satisfy the employer mandate. So you cannot use, for example, an HRA and help your employees purchase individual coverage if you're a large employer. So some people out there are touting freestanding HRAs to satisfy the obligation or the use for small employers. And I just want to warn you of the fact that there's some issues in regard to that. Any time you put individual products in a group health plan, you're going to have possible issues with ERISA, HIPAA, and COBRA. So be very careful. There's people out there touting these, and they don't understand some of the technical attributes of this. So please be very careful. Now, are there any limits on small employers in the use of HRAs? Again, please be very careful. What the IRS has said, if you're subject to the $2,000, $4,000 limit, you cannot use an HRA or an HSA to get down to that $2,000, $4,000 limit. It must be pure insurance. And the last question, what fees would be imposed on health plans under healthcare reform? Now remember, there are three fees that you should be made aware of. There's the PCOR fee. At first, there's going to be $1 a head, $1 every covered head. That's going to be imposed on both insured and self-insured plans for plan years ending after October 1st, 2012. For those plan years that end before January 1st, 2013, the first PCOR fee, as we call it, is then due by July 31st, 2013. Now, if you're insured, the insurance company will pay the fee and pass the cost on to you, and they just indicated just a few days ago that it's a deductible expense. If you're self-insured, for example, you sponsor an HRA, you have to pay $1 every employee, and you pay that fee and you report the fee by filing a Form 720 and pay the fee that way. So a Form 720. Now, if you're insured, the insurance company will pay the fee and pass the cost on to you. The other fee is going to be a reinsurance fee, which will apply to both, and that's starting in 2014. It's going to be $63 per head per year. HRAs are not subject to that, but both insured and self-insureds are subject. It's going to be collected by HHS. They're going to come out with a inquiry about how many people you cover, and then they'll bill you for that. The third fee is a health insurance company fee that the insurance companies will pay. I haven't seen the exact figure yet. They haven't determined that, but the insurance companies will pay that fee, then pass the cost on to you. So again, and that fee will be in 2014. So again, those three fees you're probably going to be charged for in the future. The first fee will be due in 2013. The other will be due in 2014. All right? Now, let's look and see if there's any additional questions. Do you anticipate employers, okay, just a second. Still unclear, the 60% plan smoker, can we still charge more than 9.5%? And what the government has said is the fact that the premium is based on whether each person will qualify for the smoker discount, so it's the smaller premium. So it's not, and it's going to be 9.5% of the smaller premium. The law says that I can only charge COBRA rates once a year. If I renew early, how do I handle this? That's a good question. I would think in that situation, I think you're going to have some problems. If somebody drops below 30 hours, why wouldn't we have to keep them on through the end of the year? Because the fact that a reduction of hours, the only time the less than 30 figure will apply, it only applies to those that are variable hour employee. For any full-time employee, that rule does not apply. So what you have to do is drop them into the measurement period and then give them coverage once they again become full-time. What about people who are on Medicaid eligible? They can still apply for Medicaid if 100% right. What are these rules? Well, again, depending on the state and depending on the eligibility rules of each state, if someone is eligible for Medicaid in your state, some states are not expanding it. It's up to 100% of the poverty line. Others are going up to 133%. But if an employee is eligible for Medicaid, then they're not eligible for premium credits and subsidies. Please remember that. But again, the eligibility of each state will vary. In some states, for example, if an individual is eligible for employer coverage, that employer coverage must be taken. So again, each state will be different. Under the PCOR fees, what if an employer has an HRA fully insured and a ERISA self-insured plan? What amount would be charged? What the IRS said is that if you have an integrated HRA plan and a self-funded group health plan, there won't be a separate charge for that HRA. But if you have an insured health plan and then an integrated HRA plan, there are two fees. But please remember the HRA is only $1 every employee, not covered head. Please remember that. Let's look at some other questions. Bear with me a second as I go through them. Okay, and the next question is, okay, just a second here. Is the $240 for policy a monthly or yearly? I didn't say $240, I said $460. That would be a yearly fee. Hopefully you're referring to my example of the person who is eligible for credit or subsidy. Now, remember the credits and subsidies will vary depending on your income. It goes from 4 to 6 to 8 to 9.5% of their income as the premium on the exchange. Now, the only place you can get a credit and subsidy is on the exchange, both for employers and for individuals. You're going to find in 2014 there's going to be private exchanges. The only problem with the private exchanges is, one, you can't get any credits and subsidies on those private exchanges. How are we reporting proof of our small or large status, and what evidence of affordability coverage? Well, for large employers, what's going to happen, there's going to be a new reporting requirement starting in 2014. There's going to be a new schedule in your tax return that you have to report coverages. But I would just stick in your file, because what's going to happen is if any of your employees go on the exchange, you're going to get evidence of that. And the IRS is probably going to inquire whether you're a large or small employer before they penalize you. So keep any evidence of your calculation of being a large or small employer. For HRAs, I thought you said that large employers can have them. Then you said they kind of have them freestanding HRAs. Correct. What they indicated is that freestanding HRAs, now there's different types of HRAs. A freestanding HRA, and let's say you're a large employer. What some employers were doing, they're offering to employees, they'd say, okay, we're going to offer you $5,000 a year. You go out and show me evidence of individual coverage or expenses, and I will reimburse you up to $5,000. What the DOL said a few months ago, that design of an HRA will not satisfy the employer mandate. All right. Now, the other type of HRA is an integrated HRA, which is integrated with a insured health plan. Those things are fine. An integrated HRA is saying, okay, what we're going to do, we're going to pay for any expenses not reimbursed by the insured health plan, and that's possible. You can do that. The only stipulation about that, and what the government said, is for small employers, if you have an integrated plan, you cannot use an HRA to get down to the $2,000, $4,000 deductible requirement. Now, large employers can do that. There's no limit on the deductibles for large employers, but for small employers, there's going to be that limitation. So, Roger, do you have any other questions or comments? I've gone through all the questions.
Larry, I think we've asked all the questions we have here. So, with that, I would go ahead and wrap it up. Greg, would you like to wrap it up quickly?
All right. Thank you very much. That's my contact information. The only reason why it's there, I have healthcare reform material on my website. Also, you can sign up for a free newsletter. It comes out 4 to 6 times a month on developments. Thank you very much. And again, this webinar has been recorded and will be available. So please, thank you very much for participating, and we'll talk to you soon. Take care. Bye-bye.